My name is Dr. Ryan Denney, and I'm a licensed psychologist here at Connections. I wanted to talk a little bit about some misconceptions people have when they come to therapy, because coming to therapy takes a lot of courage, and everyone feels nervous when they do it. We all have fears of getting rejected and judged, and so I just wanted to take a minute to talk about some of the misconceptions and myths that people often have in their mind when they think about coming to therapy. Because therapy can also be a wonderful and amazing opportunity to get support and encouragement and objective feedback on your life or problems. And so it's just really important to kind of think through your anxieties, to work through them, and to come to therapy if you need it. One misconception is that people are going to think you're crazy if you go to therapy, and that is just absolutely not the case. Me personally, when you come to therapy, I think you're courageous. Because a lot of people have life problems that they never address, that they never have the courage to talk about or unpack. And coming to therapy is one of the most courageous things a person can possibly do. Most people never ask for the help that they need, and so doing so means that you have a lot of strength, I think. Everyone needs help at some point, from someone at some time, and asking for help from a therapist is a wonderful thing to do. So you don't have to be crazy to go to therapy. Another myth, secondly, is that you're going to get psychoanalyzed. And the core of that myth or that fear is that somebody's going to judge you. And I don't see my job as a therapist to judge you. I see it to give you the best help that I can, the best perspective, the best empathy that I can possibly give you, but not to judge you or your life situations. I'm going to use my training and clinical experience to help you look at your situation, to analyze it, to look at the problems that may be getting in your way, and solutions that maybe you haven't thought of that would help you feel better. And my biggest goal is to help you build hope that your life can be better, that you can make your life better, and I firmly believe in that. Another common myth or misconception about therapy is that your therapist is going to fix your problems. No one can fix your problems but you. My job as your therapist is to help you gain more clarity about the issues you struggle with, more understanding, and to guide you as you form your plan of action, what you're going to do to make your life different and better. Therapy is not magic. There's no magic to it at all. It's just looking at your issues in a supportive environment and thinking about what you can do, because there's usually lots of things you can do. Looking at what you can do to make your life better. I found that most of us have far more courage, resilience, ability, strength than we think that we do, and it's my job to help you access that and discover that. Therapy takes work, but if you're up to the challenge, I'll be right there cheering you on every step of the way. Finally, a final misconception is that I'm going to tell you what to do as your therapist. You're going to go to therapy and they're just going to tell you what to do. As much as you may want someone to just fix or solve your problems quickly, that's not the job of a therapist. The job of a therapist is to respect your autonomy, your right to determine your own life, your own course of action, freedom to make your own decisions. And so if I told you what to do, it would be my decision and me living my life through you. And my goal for you is for you to live your own life, to make your own decisions. I will, however, help you figure out what it may be helpful to do differently in your life. Give you that objective perspective on your problems, but ultimately you are responsible for making your life better. I will help you, but that is ultimately your job. So these are some myths and to consider when coming to therapy, some common myths and misconceptions, and I hope that if you need therapy that you'll seek it.